Hello people, in this video let us look at this terminology metabolic syndrome. So metabolic syndrome is also called as insulin resistance syndrome. Okay, what is also called as insulin resistance syndrome. Now in this metabolic syndrome there are some three components that you should know. Look at this, we have written this here, the three components. They will have high blood sugar, that is glucose will be more, right, and they can have high blood pressure and then dyslipidemia. These are the three things you have to write. Now high blood pressure, let's move on to this side. Blood sugar. High blood sugar means they have diabetes mellitus. In that also, which type of diabetes mellitus are we talking about? We are talking about type 2 diabetes mellitus. That is why it is called as insulin resistance syndrome. You have understood, right? What is this also called as? Insulin resistance syndrome. Okay, so it is also called as insulin resistance syndrome. So you should understand that there are three components here that you have to write. What are the three components? High blood sugar, type 2 diabetes mellitus, hypertension, that is high blood pressure, dyslipidemia. Under dyslipidemia, you have that they have excess cholesterol, the bad cholesterol is more, the triglycerides are more, and they have obesity. Obesity is also dyslipidemia only, you can say, right? So these are the things, okay? So if they ask you, if they ask you the components of metabolic syndrome, you have to write these three, and under this dyslipidemia, you write these 3 points, okay? And for this one, you should write high blood sugar. What will you write? You will write type 2 diabetes mellitus, that is insulin resistance. You should write here. Type 2 diabetes mellitus means what? Insulin resistance. That means these people have no insulin deficiency. They have insulin, but they cannot use it because they are resistant. Their cells don't even respond to this insulin. This insulin is a waste being there. So this is type 2 diabetes mellitus, okay. So did you understand the components? Components of metabolic syndrome? Yes, say type 2 diabetes mellitus, that is insulin resistance. They have high blood sugar, very good. 1 point you told correctly. Then second point you tell. Second point is that they will have high blood pressure, hypertension, very good. The hypertension means what? Greater than 140/90 is called as hypertension. Very good. That also you can add. Okay. Then third one, what? Dyslipidemia. Dyslipidemia means what and all will be there. Cholesterol is more. What type of cholesterol is more? The bad cholesterol. That is the LDL, low density lipoprotein is more, which we don't like. That is also bad. Okay. Then after that, dyslipidemia, what is the next point? In dyslipidemia, first point we saw LDL, cholesterol being more. Very good. Then second point in dyslipidemia, triglycerides are more. Yes, that also we don't like. Then last one we talked about obesity. Okay. So have you understood metabolic syndrome? Now look at the complications that or associations that will be there in this metabolic syndrome. These people can have non-alcoholic fatty liver disease, which we have written here in small. Can you see the associations? Non-alcoholic, non-alcoholic fatty liver disease. Yes, non-alcoholic fatty liver disease. They have a liver also issue will be there. That is what type of liver they have. They have a non-alcoholic. That means not because of alcohol, but because of this metabolic syndrome, they can have this liver disease. Okay, this liver, fatty liver, fatty liver we should draw here. Okay, these people have a non-alcoholic fatty liver disease. And what else they can have? They can have, these ladies can have PCOS. PCOS they can have. Okay. PCOS means polycystic ovarian syndrome they can have. That means they will have irregular menstruation, heavy bleeding during that time of menstruation, and they can have infertility issues. Okay. Because they'll have anovulatory cycles. Okay. So this is all about metabolic syndrome. What are the other things about metabolic syndrome? Look here. Here, where are you looking? Look here at the associations, complications. They can also have gout, psoriasis, and COPD. That is chronic obstructive pulmonary disease. So these three also can be there. Gout, psoriasis, COPD. They can have mild hypogonadism can be there in men. In men, what can be there? Mild hypogonadism. In female, there can be PCOS. Okay. So this is all that you need to know about metabolic syndrome. Metabolic syndrome means you have to say high blood sugar, that is type 2 diabetes mellitus, insulin resistance, high blood pressure, hypertension, dyslipidemia. Under dyslipidemia, you have high cholesterol, high triglyceride, obesity. Okay. And in that, the bad cholesterol, LDL is bad. LDL is more. Okay. So this much if you write in the exam, you will pass. Okay. Bye-bye.